Healthcare professionals, making active lives possible.
There's significant potential for the health and physical activity sectors working together, both for the sectors themselves, but also in particular for the people that they serve. So making sure that the physical activity opportunities are more appropriate and more accessible for disabled people and people with long-term conditions. In 2013, we published the National Physical Activity Framework for England, Everybody Active Every Day. That framework is a framework for national and local action, and it highlighted the need for an inclusive approach to create an inclusive physical and social environment to help people to be more physically active.
There's a bit of a misconception that sport is viewed as leisure. Of course it's leisure, but there's actually something really crucial, I think, and profound about sport and activity, and that is it is an effective clinical intervention that healthcare professionals can promote.
Sport for Confidence is a social enterprise which directly places healthcare professionals into leisure centres. I've been an occupational therapist for almost 20 years. About 6 years ago, I was really keen to demonstrate how occupational therapists could use sport and physical activity as part of their day-to-day practice with the clients that they were working with. I wanted to move away from a traditional approach and perhaps traditional clinical environments, and then a couple of years ago I became the first occupational therapist in the country to be working in a leisure centre. For our sessions, it's about learning new skills, meeting new people and getting involved in something that perhaps previously you wouldn't have got involved in. And the focus is the occupational outcomes, not so much the sport outcomes. And in the first 6 months, I think I had 2 people attend my boccia session, and that 2 people grew into 8 people. That one boccia session became 15 people. That became 2 sessions, and now we see about 400 people a month.
How do you feel when you come here every Tuesday? That means happy, you're happy to come here.
I really like it here.
I love sports because I love football, I love soccer, I love badminton, I love tennis, and I love all my friends.
You'll get more out of your clients if you bring them to a setting like this because it's bright. You can gain confidence, gain new skills without realising.
Yorkshire Sport Foundation is a county sports partnership which covers West and South Yorkshire. The aim of Creating Connections is to try and get disabled people more active and living a healthier lifestyle. Within the local authorities, we do link with the public health team, but we've also reached out to lots of different places. So we've gone into hospitals to work with their physiotherapy team and also occupational therapists.
Part of my role is working on the Creating Connections programme, which is working with disabled people and linking them to community opportunities involving physical activity and sport. Leanne was recommended to us by a recommending agent, the visual impairment team at Calderdale. So we spoke about wheelchair tennis, we spoke about wheelchair curling, and we spoke about visual impaired bowls, and she tried everything, and this was the one that stuck.
I enjoy it to meet more people. Then I get on with them like friends. I like to be on my feet all day. If I am at home, I am bored. I feel better coming here.
For me, physical activity and health needs to become more central to the NHS and to healthcare. It's not a sideline, and everybody has a responsibility to do that. It's not just about what we do in healthcare, it's where we do it in healthcare. It's about pulling all the assets of a local community together.
My key message to a healthcare professional would be to recognise the potential of physical activity to improve the health of their patients, to understand that they're in a unique position in terms of one in 4 patients suggesting that they would be more physically active if recommended by a healthcare professional. Lastly, it's about them understanding what the physical activity opportunities are and linking to them in their local area.
This was a lifeline to me. If I hadn't been doing this for so many years, I'd have been doing nothing.
After a day of bowling, I feel buzzing.
If you're a healthcare professional looking for more information and guidance, visit activityalliance.org.uk/health or call 01509 227750. This film was created in partnership with Public Health England.